Բարեկամներ, այսօր դարձյալ մեր հեռուստաեթերը տրամադրում ենք դոկտոր Օհան Քարատոպրակին, ներկայացնելու համար իր հարցազրույցը դեղագործ Խորեն Նալբանդյանի հետ.
Hi, and welcome again to AHHPO's American Armenian Health Professional Organization's TV Health Program. I'm Dr. Ohan Karatoprak. Today we'll try to answer two commonly asked questions in doctor's office and pharmacies. They are confusing. First one is the generic medication versus brand name medications. And are they the same? They have the same chemicals. What do they do? Are there any differences? And the second will be the question about Medicare Part D and other private insurances formularies. What kind of medications they include or exclude, what pharmacists can do and what pharmacists cannot do. To answer all these questions, I have very experienced pharmacists with me, Mr. Koren Nalbandian, who happened to be a founding member of AHHPO, and he was a senior pharmacist in NYU more than 30 years, and he owns a private pharmacy in Fort Lee, New Jersey. Mr. Nalbandian, welcome. We have a very confusing issue. I'm sure we're going to clarify with you. Let's start with this generic medication and brand name medications. So, what is the difference between generic and brand name medication?
Generic medications are identical to brand medications, and they are manufactured and distributed without having a protection of a patent. Once a brand medication loses its patent, which is between 7 to 12 years, then generic companies have the power and the freedom to manufacture the same formulation,
the same chemical,
under the same chemical, exactly identical the same chemical under the generic names, sometimes brand generic names. So, FDA has approved all generic drugs being identical 100% for the composition of the brand medications.
Sometimes patients come and say, well, I take this generic medication and I don't feel good. You think that there's a psychological effect on that?
Most likely, yes. Especially some generic drugs are totally different in color and shape from the brand medication. So initially, when they deliver the generic drug without telling the customer that this was a substitution, the patient becomes
confused,
surprised and confused, and if he's not prepared by the doctor or the pharmacist and educated that the generic drug is 100% the same,
as the
initial reaction is psychological. From time to time, again, some colored generic drugs might be somehow not the same. If the patient has allergies to a yellow dye or other colors, that is only 1 per 1,000.
As pharmacists now, when you get the patients and they have a prescription and they have Medicare Part D, and that particular, let's say, prescription is not covered by their insurance, you have a problem, obviously, because the patient doesn't understand why. What do you tell the patient? Okay. What should we tell our patient?
Before going to the Medicare Part D prescription plans, I'd like to say something about generic drugs. We have here Zitromax.
Yeah.
This is the brand that costs $60.
Azıcık memnun tutsunenk. Azıcık Zitromax ne?
Zitromax ne var $60.
$60.
Եվ ասիկա Azithromycin նույն ֆորմուլան է։
Նույն ֆորմուլան է։
Որ $20 է։ $20. This is manufactured by Pfizer. And this is manufactured by Sandoz. Երկուքն էլ աշխարհահռչակ կամպանիներ են։ Ուրեմն ասի մեկ օրինակ։ Ուրիշ օրինակ մը Coles, որ ասիկա over the counter գզախվի։ Coles-ը սոֆտներ։ Եթե բրանդը գուզեն $25 է 100 հատը, որ կրբանին բիտ վճարի աջախորդը։ Իսկ generic-ը $5 է 100 հատը։
Որ երկուքն
ուրեմն ճիշտ նույն ասես նույն chemical-ն են։ Եվ երրորդ վերջին օրինակը որ գուզեն նշանավոր Zoloft-ն է, որ depression-ի համար կորզածվի։ Այո։ Zoloft the brand costs around $90, the generic costs only $10 to $15.
Right.
And this is երկուքն է նույն ֆորմուլան է, նույն ծևն է, նույն կոյնն է։
Նույն սերտրալինն է, մեջինն է։ Chemical value նույնն է։
Նույն ֆորմուլաներն են։ Հիմա անցնենք, անցիբարձը ուզեցի ասել, որ ժողովուրդը գիտնա որ ինչու համար generic դրագներուն պետք է հավատայ պետք է քաշարերը։ Քանի որ ինշուրենսներուն գերտանք, մասնավորապես Part D։
Այո։
Before I go to the Part D as such, I'd like to make a little introduction. What is Part A and what is Part B and Part D? The Medicare Part A is the part of Medicare that covers all hospital expenses.
That's Part A.
And hospice and related services.
Issues, right.
The Part B is doctors' offices, laboratories, certain drugs like oral cancer drugs, and injectables.
It's covered under Part B.
Under Part B. Now, Part D is strictly the medication plan for the Medicare patients.
And they have to enroll every year?
They are qualified for this plan with a little amount of co-payments every month, that varies from $25 to $30 every month.
Every month, right.
That they can pay from their pocket or can be deducted from their monthly payments by Medicare.
Right. And it's not automatic. They have to enroll every October.
They have to enroll every November 15 to 31 to be covered by the next year, January 1, by Part D.
Right.
Part D has 4 components.
Right.
4 մասեր է կազմված է։ Առաջինը is the deductible. Ամեն Part D անհատ, որ Part D ունի, փախուս չի գա։ Except those who have low income,
right,
Medicaid, then they are exempt from the deduction.
Otherwise,
but whoever has over $15,000 income, average income, and they have Medicare Part D, they have to pay from their pocket up to $280. This was for the year of 2010. Deductible. Like they pay for their life insurance, like they pay for their car insurance deductible, then starts the co-payments.
So $280 is a deductible they have to pay beginning of the year.
From their pocket, yeah. Ուրեմն գարզենք, որ մեկը դարեկան $10,000 թեղի վճարում պետք է անե։ Առաջին $280 կրբան ընկել է։
That's deductible.
Deductible. This is one component of the Part D. The next one comes from $280 to up to $2,800.
And it got covered there with the copay.
Copay and insurance. Andor մեկ մասը հիվանդ ինքը կվճարի կրբանեն, որ $5-ն 35-40 գլագախում ունի, եթե brand գարնե 42 է, եթե generic գարնե 5 է, հոս կուքա ինչու համար պետք չէ որ անբաչար brand առնե, եւ որ brand գարնե at $2,800 շատ արագ կերտա։ Որ ամեն բան կրբանեն պետք է տնի։ So զիտրոմաքսը առնելու $60, գերտամ generic գարնեմ 20, որը տրամը չի վերջանա։ So the next portion of the Medicare Part D was the co-payment and the payment of the insurance. And the third one comes the bad part of the Part D.
The donut.
The donut part, which is from $2,800 to $4,500. There, the patient is 100% responsible from his pocket.
Memnun expiration date խոսենք։ Հիմա երբ պետք է տեղայլևս չանեն։
Expiration date, երբ որ թեղը գարնեք եւ շիշին վրա թվական գա, այդ թվականին 1 տարի ամեն մեկ տեղ լավ է։ Իսկ եթե շիշ մգա որ վրան արդեն expiration date գա, անթվականին հետևեցեք։ Գարկ մթերել գրնակ 1-2 արաբելակուն 3 օր առնել եթե expired են, մինչև որ ժամանակ ունենաք նոր թեղակեր առնելու եւ նոր թեղը քնելու։
Շատ աղի։ Շատ շնորհակալ եմ։ Գուսամ նոր ենք դեսնենք որ ավելի փաստադրենք, ավելի մանրամասնություն տանք, որ չգրցանք այսօր խոսիլ over the counter medication, but hopefully a second program.
Ինձ համար ալաջուկե, it is my pleasure being here as a founder of AHHPO and as a colleague of Dr. Karatoprak for this talk and to serve my beloved Armenian community.
Thank you. Now it's time for articles of the week. I have 2 articles about green tea and its effect on depression and psychological distress. Depression in late life and psychological distress are recognized public health problems. Depression and psychological distress can increase the risk of medical illness and can worsen the outcome of the illnesses. Green tea contains an amino acid called theanine, has a beneficial effect on stress, inflammation, and as well as on depression. Tohoku University in Japan, in 2 different studies, studied the relations between green tea consumption with depression and psychological distress. The first study was conducted on 1,058 elderly individuals aged more than 70. The second study was conducted on 42,000 Japanese individuals aged more than 40. The higher green tea consumption, which was more than 4 cups a day, was compared to a low green tea consumption, which was less than 1 cup a day. The conclusion was higher green tea consumption was significantly associated with lower depression and lower psychological distress. Besides, green tea is good for weight loss. I'd like to remind you to visit AHHPO's website to get up-to-date health information, as well as you can watch this TV program on website too.